It is 10:08 at WPSL 1590, the Talk of the Treasure Coast. And you're on Bone Talk with Dr. Joe. Where's Becky?
Hey, good morning, Greg.
How are you?
Good, good. Audio coming through okay? I'm hearing a little buzz on my end. Everything good?
Oh, no, we're fine here. That's for sure.
All right, great, great. Morning.
May just be something in your head, you know.
Yeah, yeah. Hopefully there's something in there.
Well, I'll tell you, our IRSC Pioneers, aside from being the number 6 team in the country, we have a player, Amir Burkat, who has been out of the game for a couple of years. He had one of the worst ACL injuries I think I've ever seen. And he's back. He's playing, he's got free motion. And wow, that kid is something. He's fought his way back.
Yeah, and the ACL tears, they come in all different sizes and shapes. You have your standard just ACL tear, you just tear that ligament. But what the ESPN and the Adam Schefters of the world don't tell you about is what else happened at the same time. Did they dislocate the knee? Did they break something? Did they tear part of the meniscus? And in what specific part of the knee? You can have very different long-term outcomes. And so that's why ACL tears just on the surface can sound so unpredictable. And that's why it really requires just a kind of a hands-on, what's my prognosis with the orthopedic surgeon. And that's something that they may only discover too after the surgery is what else happened. The MRI helps for pre-surgical planning, but it's really once you get in there, that really helps to tell them about what the long-term future is kind of once they had to go in there and fix things up.
So there's a possibility the MRI might miss something. I mean,
the MRI is not perfect. Yeah, so depending on what kind of problem you're looking at or what specific injured part you're looking at, an MRI, it could miss certain ligament tears, let's say 20% of the time, certain ones. With other things, it's much more accurate with. Like, for example, an MRI is never going to miss a fracture. Outside of a very, very, very tiny fracture that would be pretty much insignificant. But certain ligament tears, certain tendon tears, an MRI can miss because an MRI, the frames are only so short together. And so there is going to be some missed things. But the smaller the injury is, the less important the ligament or the tendon is, the less likely it is that you're going to miss something. So the MRI will catch most things.
Wow. Yeah. And on the ladies' side, Brianna Campbell coming back after MCL surgery. It was just 6 weeks ago. I mean, it's like, wow. And she's back.
Yeah. It takes a while, but you do it right. You do it right the first time, and then it's not going to be an issue going forward, or let's say it minimizes the chance of recurrent issues going forward. Whenever you injure the body, whenever you injure some of the tissue, it's always going to be prone to repeat injury again. There's certain parts that it's not. So we've talked before on the show about when you break a bone. The old wives' tale is that the bone will come back stronger than before the break, and that is partially true. When you break a bone, after that bone is done healing, let's say 3 months, 6 months after that bone is done healing, that bone is stronger than before you broke it. Now, that's not the same for tearing a ligament, tearing a tendon, tearing cartilage. That is the exact opposite. It comes back weaker and more prone to repeat injuries. But the body is funny in that it can heal bone much better. I guess bone, it's a different kind of tissue. It's solid. It doesn't require any dynamic movement with it, and it doesn't have to have any give to it like tendons and like ligaments do. And cartilage, of course, the body just does a terrible job of healing that. But bones are unique in that they come back stronger than before, and you shouldn't have long-term problems with that, unless, of course, you damage something else. Herniated discs, I'm talking about that all the time with patients. When you have a herniated disc, yes, we're going to get you to heal that, but you're always going to have an increased risk of injuring that again or injuring your back in a different way again because it throws things off. But yeah, so that's why all these different injuries are so specific in what your prognosis is. Another one that we hear all the time is, well, I heard that breaking my ankle is better than spraining the ankle. And that one, a lot of that is true. Ankle sprains tend to take, on average, a lot more time to heal than an ankle break does. Uh, and of course, it depends on the kind of ankle break, the kind of ankle sprain. Most often, the breaks in the ankles tend to be more smaller breaks, while the sprains tend to be bigger sprains. So most often, that holds true.
Wow,
Um,
that's that's interesting. There's no doubt about it. Well, let's see what Jerry's got for you today. Jerry, you're on with Dr. Joe.
Thank you, Greg. Good morning, Dr. Joe.
Good morning.
I was wondering, a while back you explained the term loxia, which is an older term. You explained that it means a neck injury, and I had a stroke about a year ago. I'm kind of hard to understand, but I was wondering about, I understand the thyroid is in the neck, which apparently controls the growth of your body. And do you see a lot of athletes with neck injuries? And you know how I just wonder if you had a specialist in neck injuries at your hospital. And the term is loxia, doctor. I'd like to listen off else. I'll be okay.
Sure, absolutely. Uh, so first of all, let me address your question about athletes and neck injuries, and they can be very complicated. There are certain parts of the body that there is a lot of important structures very close together. Um, so the neck is one of those. There are important nerves with your spinal cord there. There's important arteries that supply blood to your brain, and there's important glands like your hormones, and of course your breathing and swallowing tubes. And so your thyroid is one of your hormonal systems. And so neck injuries can be very complicated and depends on what you injure. What we worry most about is kind of blunt trauma to the neck, something like a hockey player who's taking that hockey puck to the neck. I mean, that can injure an artery and cause a dissecting aneurysm and cause strokes potentially. Um, that would be the most feared injury to the neck outside of damage to the spinal cord itself. If someone falls wrong and of course injures their neck, we see that all the time in contact sports. The other ones don't tend to be as severe as long as there's not anything penetrating. So kind of contusions, hematomas of the breathing and swallowing tubes don't tend to be as bad. So we worry more about the arteries and nerves and damage in the neck. Um, the thyroid, very important gland in your neck, and it's a very common problem for people to have thyroid issues. Women, especially as they get older, some people say that with having more children, so more than 3 children, they're prone to more thyroid issues. And luckily, the thyroid is one hormonal system in the body that we have a better medical grasp on treating that. So when someone gets thyroid deficient, it's very common for them to go on a medication called Synthroid, and that helps to replace some of the thyroid hormone that the body isn't making anymore. And that's from hypothyroidism. Hyperthyroidism is much more rare, but we also have some great medications to fix that. But thyroid issues, when they're uncontrolled, it's kind of like when someone has low testosterone, or when a woman is going through menopause. It affects nearly everything in the entire body. It can affect your stamina, your sleep, joint pains, your hair, your skin quality, your energy levels. It affects everything all across the board. So a very common problem is someone will come to see me and they're just talking about all their joints are aching, and they just don't have a grasp for what's going on, and they're asking me, why am I having all these things? And part of my plan with them is, when's the last time you've seen a primary doctor? And I know I've gotten on my soapbox on this show to talk about it before, but unfortunately, uh, not enough people. I'd say I'm going to guess less than 30% of people that I see are going to see a primary doctor like they are supposed to. And it is my opinion that everyone, no matter what age you are, needs to have a primary doctor, and that you should have an annual exam with them. An annual exam every year. You should be seeing your primary doctor. Now, for some people, it's less important. Kids, let's say ages, 5 to 20. Yeah, less important, but still, there is some value in that. but pretty much everyone else, it is very important. You need certain annual blood work where they check for things like, electrolytes in your kidneys, protein in your kidneys, making sure your liver is functioning fine, and also for checking for things like hypothyroidism or testosterone, uh, low testosterone, low vitamin levels, because this can affect, like I said, your sleep, your stamina. And these are very common issues that we all have in society. And you don't want to be missing something simple. If you've been dealing with a thyroid issue for 10, 20 years, and you've just been writing it off as, oh, I'm just getting old, or, oh, people have sleep issues, no big deal. Think about all that wasted time that could have been fixed by a simple little medication. This is a reversible problem. So thyroid issues are one that a primary doctor would fix very easily. So if you don't have a primary doctor, get a primary doctor, even if it's just for some basic lab work. And if they tell you you don't have to see them as often as every year, great. But on the surface, I say see them every year unless they tell you otherwise. There's my long-winded answer about thyroid issues and neck injuries in athletes.
Yeah, I wish you'd stop harping on the got to see a doctor once a year.
I know, preventative health. We have all these years of advancing medicine, and you think about how far medicine has come over the past, let's say, 50 to 100 years. I mean, wow, you look at the list of all the things that people were dying from 100 years ago, they're not dying from them anymore. These are vaccine preventable illnesses, certain types of pneumonias that are prevented now, polio and pertussis, all of these things that they were dying from before. And now with all of our advancements in air quality, in sanitation, I mean, people were dying before from things that we can currently now prevent through vaccinations, and that we now don't have problems with because of proper sanitation and air quality. It is unbelievable. And so our other things are the advent of like the antibiotics. People don't die from skin infections anymore because for the most part, we have antibiotics that cover these. So it is amazing how far medical technology has come in the past 50 to 100 years. And that's part why we're living so much longer. All you have to do is go to the doctor and get checked out. And a lot of these issues can be taken care of and prolonged. So yeah, so I recommend people use the technology of today.
It's very interesting, and I know your wife is a dentist, but it is amazing to me. And I was going to see my regular doctor, once a year, but my dentist told me that there may be a heart issue. And so at this point in time, I had not seen a cardiologist over here, and I never had one in Los Angeles. And he was right. He was right. And it just absolutely blew me away.
Yep, and certain specialists, they may be the first person to pick that up. An eye specialist, for example, when they look in your eye, if they see certain changes in your cornea in the back part of your eye, that may be a sign of diabetes or high blood pressure. And so seeing your eye doctor and just checking your vision to make sure you're absorbing our beautiful world properly, they may pick up on certain things. And they do quote some studies that they may be able to pick up on some changes in your eye before something like a blood pressure test will. That may take some time to develop and show in your actual blood pressure numbers, or that they'll pick up diabetes in the eye before the current blood test will pick up diabetes. And I do agree with that one about the diabetes. I'm not as sure about the blood pressure one. But yes, you mentioned dentists picking up other problems. For the most part, you don't want a specialist in your eye or in your mouth to be the first one to be diagnosing those other problems. For the most part, that means that this problem has gone on way too long and too much of a problem, and that's why they're picking that up. Me, for example, I shouldn't be the one picking up on a thyroid issue or on a cancer in your bone because of a breast cancer that has traveled over to your shoulder. It is never good if the specialist is diagnosing you with something else like that. That means that this should have been picked up long before. So again, back to the primary doctor thing. But it does happen. Yep, the dentist will pick that up. Eye doctors will pick that up. So Yeah, you're right, Greg.
Yeah, that really is incredible. And Harbor Place, who has a show on Tuesdays, they have a machine that you're scanned by when you go in there, and it can tell if you've got COVID or not. I mean, it's like, okay, this is really, really cool. It takes your temperature, and then it scans the eye. There you go again, back to the eyes again.
Mhm.
And scans your eyes. It can basically say if you got COVID or not.
Sure, sure. Even so, a lot of people today are into the wearables. Like an Apple Watch that tracks your, your heart vital signs, your sleep pattern, and whatnot. There are other rings that you can wear on your finger. Other wearables that track these different metrics. And what they're finding is that with some of these wearables, they can pick up when a woman's period is about to happen. They can pick up when they're pregnant, on average about a week before the urine test is going to tell them that they're pregnant. It can tell you with a high degree of certainty if you're about to get sick, and specifically with COVID. There are certain metrics that change with your heartbeat. How your heartbeat is variable, and how fast you're breathing, how oxygenated your blood is. And through a combination of putting these metrics together, it can tell you these things. It's amazing where these wearables are at right now. And it's only going to get better when you consider some of these wearables that are happening for like type 1 diabetes and tracking your blood glucose. Once that technology gets even better, it's really going to open the door to a number of different blood tests that these wearables can detect, and even that much better health. So yeah, we love the wearables. Right now, it's I think there's still some progress to come. Right now, I think they just need to incorporate what are the important variables, and then we just need to study it a bit, which is very easy to study. So look out for the wearable technology to really be a big part of our medical care in the future.
That is truly amazing. Rush Limbaugh used to laugh about. Of course, he was an Apple freak, and he got one of the early watches. Well, and he occasionally would dance around in the studio or and stuff like that when they were playing music, bumper music. And so apparently this sent a false alarm to his watch. And he said all of a sudden the fire department shows up with paramedics and that he was having a heart attack. He was just dancing around the studio. But yeah, it's that was
They're not perfect. And so the cardiologist will tell you too that one of the downsides with the wearables is increasing patients' anxiety about underlying conditions. The watch or your iPhone is not perfect at doing an EKG where they're attaching electrodes to your chest. And so it's more likely to say that something is abnormal when something is really just normal and it's just not recording it properly. And so there is a false positive rate. So that's one of the downsides, is that it can lead to additional testing and additional patient fears. And we don't want that either. But it's just something to know about. And so, I mean, my watch has gone off before telling me abnormal heart rhythm, and I've been to medical school. I know kind of the algorithm to go down, and so I can clearly see that the watch is wrong when it says that my heart rate is 200, and so it's having a little bit of it's on the fritz. But if you don't know some of these things, you could worry about that and rush to the ER and then get admitted for a possible heart attack. So. And I can't really tell you, don't do that, but kind of use some sound judgment and hopefully ruling out that the watch is telling you something wrong.
time to reboot your watch.
Yep. Yeah. Reboot the watch. Maybe go down the street to your pharmacy, get your blood pressure checked. Check and see if your heart rate really is 200 or not. Most people should know how to check their pulse. It's a pretty straightforward thing to do.
Wow. See, now I don't know how to do that. I think Carol does, but I would have no clue. Have you seen the
Yeah.
commercials where you put your fingers on pads and supposedly it's like a home EKG kit in a way? I don't understand that, but
Yeah.
they're
Uh,
trying to sell this device.
I've heard the cardiologists say really good things about it. As far as the accuracy and how it compares to an actual EKG, I really can't speak on, and I haven't heard any cardiologist say what percent of how good a normal EKG is with these home units that you're buying. But I've heard them endorse them in people who don't have bias and people who mean good. So I think there is some value to them. I mean, if you're a person who's really worried about your heart and is worried you're having palpitations or heart attack symptoms, I think it's a valuable investment. And your cardiologist would likely like that information, but I can't tell you how accurate that is.
Yeah, and it's like anything in technology, it's all going to get better. You know it
Oh yeah.
is.
Yep.
And like with each Apple Watch that has been released, they've all got newer technology, and that's just where we are in the world right now.
Yeah, newer technology and newer metrics that we're now able to analyze. Before you couldn't, a wearable wouldn't tell you what your blood oxygenation level is. You're 90% on oxygen versus 100% oxygen saturation. The newer technology and the newer wearables can. Something before they weren't able to tell you was a topic we talked about on last week's show, heart rate variability. Before they were just monitoring your pulse. Now they can also tell you about this additional metric called heart rate variability. That's a complicated metric, but tells cardiologists, family medicine doctors, and even psychiatrists things about you. Yeah, so they're improving. Heck, I mean, next, who knows what's next? I never thought that we would be having a wearable that could tell someone when their period is going to be, when they're about to get sick, when they're pregnant. I never thought that was possible that a wearable would do that. So who knows what they're going to come up with next? But it's awesome.
Yeah, I really embrace that stuff. It's like this is kind of fun, and just take it for what it is. But yeah, it could become a very, very serious thing for you.
Yeah,
And
yeah,
and it might
absolutely.
save your life. You just don't know.
These things do. They do. You hear about the person who never knew that they had atrial fibrillation, but their watch keeps telling them that there's something abnormal. Um, and come to find out they have atrial fibrillation. They never had any symptoms of it because sometimes this irregular heartbeat, sometimes people don't notice it. I forget the term. It's like intermittent afibrillation, or it's so long since my cardiology days. But in these people, it's actually the most scary type of atrial fibrillation. They have no symptoms, so they don't know what's going on under the surface, and it comes and goes. And what happens is in atrial fibrillation in these people who have this certain type is that sometimes the heart is beating normally, and then other times it's beating abnormally. And when you get this change, you get different kinds of pooling in the heart of how the blood sits in the heart. And so in these people, when it changes from one to the other, they're more likely to develop a clot when it's functioning. I forget if it's normal or abnormal. And then when they switch, they're more likely to move that clot and send it to the lungs or to the brain. And then they either have a pulmonary embolus or they have a stroke. And so these are people that if you discover it before they have symptoms, it's 100% going to change their lives. They're not going to have a pulmonary embolus. They're not going to have a stroke because they're going to go on the right kind of medications ahead of time. And they're going to be more attuned to looking out for when they're in atrial fibrillation, maybe getting a procedure so they get popped out of atrial fibrillation. So the wearables are changing people's lives. I really like the wearables too for sleep improvement, because if you can't measure something, you're not going to be able to improve it. And now that we're actually able to get some sleep metrics on people, where people are actually able to get real-time feedback on the quality of their sleep, how much they're sleeping, now you're actually going to improve that. And when you're not improving it, these are the people who are coming in now to get sleep studies done, to check with their dentist to make sure that there's not an airway issue and they're not having sleep apnea, which again is a silent killer a lot of the times. So these wearables are changing people's lives in a major way.
Well, and it's kind of funny. The smart beds. I think my bed is a lot smarter than I am. But it will do that. It will tell you how long you sleep, how much restless time you have, and how long you've been out of bed. The whole thing. Yeah, it's crazy.
Yep. And for those people who are interested, I mean, the Apple Watch is good, and that's an adequate wearable. Uh, I have my personal favorite out of the wearables is a ring that you wear on your finger called an Aura ring, Oura. You can wear it all day long and it'll monitor things, or you can just wear it at night, and it'll download data right to your phone. So those are my personal favorites. If people want to look into them, they can get expensive. But when you consider the things that we waste our money on, a couple $100 for a wearable, and how much health improvement that's going to give you, uh, assuming, of course, you're going to act on that information, uh, I think it is very much worth the investment. I was talking with my brother about it, who says that he gets bad sleep, and I was telling him that he should do this, and he said, "Well, why am I going to spend $200 or $300 for a ring to tell me what I already know, that I'm getting bad sleep?" He tells me he's not going to act on it. He has no desire to improve on this. He's still sitting in his bed on his cell phone, watching TV, in a bright room. He doesn't want to listen to any of the recommendations. And so, right, so a wearable is not for that person. But if you're actually interested in improving your health, then a wearable is very beneficial.
Yeah, you got to get rid of those blue lights that are in your bedroom,
Yep. Blue light is one of them. Additional sound. You just think about what's distracting you. You got to remove distractions. Uh, and our brain, it likes to find distractions. Mhm.
Yeah, that's Carol calls me a distraction. I don't understand.
There could be good distractions, though. Yeah, maybe you're a good one.
I love it. I love it. So
Telephone.
now, how much
Uh,
is the ring? I mean, I'm fascinated with that. That's
these rings, they could be $200-300 for
okay.
for
Where
one
do
of the
you even
variables.
get one of those?
The internet, you just search for the Aura ring,
Or a
Oura.
ring? Okay.
Yep. I did a fair amount of researching on the different wearables, and this was the highest recommended by certain doctors that I trust in the sleep medicine field. Um, it's the lightest weight, has the best storing capability, and tracks the most metrics that really help with health improvement. And it's a very simple technology to use also. As long as you're used to dealing with an Apple phone or an Android phone, and dealing with those apps, yeah, it's very easy to use.
Wow, that's amazing. I'll have to look at that. Now, is it like a ring? It's or
Yeah, it's like an actual ring that you put on your finger. It has a couple of small plastic probes that just indent ever so slightly. I'll say about the width of like a pencil tip. It indents a little bit just into the skin. It's not like you feel that indentation at all, but it's just a simple ring that's much thicker because there's a lot of technology in that, and then a couple small protrusions.
so this is just for
You can wear
nighttime?
it daytime too. It can do things for your exercise program, monitoring your heart rate and your oxygen levels when you're doing that. If that's something you're interested in, primarily, most people I know will use it for sleep. Wearing the ring, it's not especially bulky, but you don't want it so snug that you can't take it on and off. And so some people don't like it, that it's a little bit more likely to come off than other rings. And so they won't wear it throughout the day because it's a little bit looser than a normal ring. Because you
Oh,
do have to be able to take this off occasionally and charge it, once or
sure.
twice a week. Yeah. So it
Wow.
can't be as
Okay.
snug.
Well, absolutely amazing. So it's called an aura.
Yep.
I'll have to
Oura.
look
Yeah,
that.
check it out. It's not for
Well,
everyone, but if you're interested in improving your health, this is one way to help you.
well, welcome to the show, the Sleep Show, formerly known as Bone Talk. If you have any questions, give us a buzz 340-1590. Man,
Yeah,
we've covered a lot today.
yeah, we're all over the board. Yep. Yeah. Oh, yeah. So you gave the number for Bone Talk, 340-1590. And of course, if you want to see me, Dr. Wurzbecki, in our clinic, it's 335-4770 for Florida orthopedic specialists. And you can come and see us in Port St. Lucie or in Stewart. We have the two offices, 335-4770. We'll connect you to either office.
And again, you've got therapy in both locations. Your MRI is in the Port St. Lucie location, right?
Yep. And that's something that I'm continually surprised on too, is just how easy it is for patients. And I'm reminded of it when someone goes somewhere else for physical therapy or for MRI, which of course they can, as long as you're getting these things done, great. But the other day it took the patient an extra week or two to get the MRI because they wanted to go to a different spot. and things were lost in communication because, of course, we're not in charge of that other MRI, and so we're not able to help you with follow-up when we know the MRI has been done. I can't see the images as quickly, and so having the ease of it being all under one roof is really helpful to the patient. Things are done quickly, efficiently, and in good communication. Same thing with the physical therapy notes. The outside physical therapists, they don't always send me their notes. Here, I can see everything that you've been doing with the gals and with Mark back in physical therapy. So there's a real ease to it, and especially when you're dealing with these pains, you don't want to be dealing with these additional issues that you don't have to.
Yeah,
So
well,
yeah, it's
and,
nice.
I've been in the therapy area where either you or Dr. Rob or Dr. Forster would, wander on through there. I mean,
Oh yeah.
oh yeah, and that was kind of a regular occurrence.
Yep. And two, I mean, it goes without saying, or almost without saying, but people are so surprised to hear that we have X-ray on site. Oh yeah, we have X-ray right here. It's not like we're ordering you to go down the street and then get an appointment there and then come on back in. You're getting that X-ray done in minutes after we're ordering it, and we're seeing it immediately. Everything's digitized now, and so it pops right up onto the computer. If you need an image of that, you can either snap a picture of it with your camera phone, or I can make you a disc and you can take it with you. You don't have to deal with those big films, like back in the day. Yeah, no developing X-rays anymore.
Wow. Yeah.
Yeah.
Yeah. That's truly amazing. And for folks who are listening, maybe for the first time, Dr. Joe is the non-operative physician at Florida Orthopedic. And you do something quite unique when administering your shots. And that is utilizing, I don't know what the technology is, but you can explain it where it will guide you as to where you really need to put that needle.
Yep. Yeah, you're talking about the ultrasound, and that's what I'm the specialist in. My partners, we have Dr. Powers, who's a specialist in hip replacement surgery, or Dr. Sellers, who's a specialist in sports medicine surgery. My specialty is with the ultrasound and ultrasound guided injections. And Greg's exactly right. I mean, if you're not getting an injection with the ultrasound, then who knows if the injection, the needle's going at the right spot? Who knows if you're hurting something else at the same time? Because you don't know, you can't see the needle tip. It's not going to be as accurate. It's going to be more painful, and you're going to be more prone to side effects. So, yep, that's one of my specialties is the ultrasound and those injections. Right now I'm reminded of all these different tricks, that I've been trained with, because right now I'm dealing with a knee issue, and it's not getting better, and it's so frustrating, and it gives me a lot of empathy for my patients, and so I'm pulling out all the different braces, which is again my specialty, telling you what kind of brace may help you best if you would use a brace, what kind of topical medication is best, what injections, what types of physical therapy exercises, and a big part of what we're talking about is how you need to be modifying your activities. I mean, when you have a knee issue, you can't be bending in that knee. If you're getting up and sitting down from a chair, well, you got to be favoring that other side. You got to be using your arms. Even something simple like bending forward or stopping hard, you need to be stopping with that other leg, and it really affects every part of your life. With the knees, luckily we don't have as many stairs here in Florida or hills, but going up and down those, you need to be going up and down those properly. Otherwise, your knee pain is going to get far more irritated and stay painful that much longer. Uh, in physical therapy, one of the things they're teaching you is some of these concepts I'm talking about right now, but the stair one is especially important. When you go up and down the stairs, it's a big trigger for knee pain. And if you don't do it right, then you're going to irritate it more. And what we say in physical therapy is that you go up with your good knee first, down with your bad knee first. And if you think about that, when you're going up first, that first knee that you plant with and push up, well, you're putting all of your body weight through a knee that has to go from bending about 90 degrees up to 180 degrees. And so you're putting a lot of force and tension through that joint. While that other knee that is just coming up and going from one flat surface to the other, you're not putting any asymmetric forces through that knee. You're just putting a standing force through it. And so the same thing goes when you're going down. Well, then why does it switch when you're going down? Well, think about when you go down a step. Okay, you want to go down with the bad leg first, and the reason is because when you go down, you're putting that changing force through the knee that's still on the stair as you bend it, and that other leg that's going down is just planting on a single straight leg. So you want that changing force that's going through 180 degrees to 90 degrees to be going through your good knee, not the bad knee. So one of the ways that we remember that is some people will say, well, you just remember it like your cholesterol. Your cholesterol, you want your good cholesterol to be up and you want your bad cholesterol to be down. So you go up with the good leg first, down with the bad leg first, just like your cholesterol. I've heard some people say that they remember this in the same way. Some religious people may remember this. Up, good goes to up, down bad goes down. So yeah, that's another way to remember. But it's very important that you practice this, get reflexive with this. And that's one of the ways how people get better is when they change some of their natural reflexive motions that they don't even realize. Let's say that you have a bad left knee. For years, you may have been using your left knee as the knee that you always lead with, that you always go down with, that you lunge with. And that may be why you have a bad left knee. And now, as part of you getting better, is modifying your activities. Well, you need to reflexively catch yourself before you go down with that left knee, that you need to be going down on the right knee. And over time, by minimizing some of those forces, the left knee will heal. Yeah, you may develop another knee issue, of course, but well, right now we kind of have to rob Peter to pay Paul, one of those things, and hopefully things will stabilize before the right knee really starts bothering you, and you can kind of give equal forces again. Now that's one
Wow.
way. That's one way that the braces work too. The braces, let's say I'm about to bend with my left knee, but I feel something different on my knee. My brace starts to tighten up. That's another physical reminder that I shouldn't be doing that. So you catch yourself and then you do it the way that you're trying to train yourself. That's how braces work in all different parts of our body, including giving stability. It's also a mental reminder for how we're supposed to be training our brain and our body to how we need to act now.
That's amazing. I've developed a little something in my left knee. Just getting on and off the team buses.
Yeah.
And because they're very steep steps, and I'm being shorter. And it's just all happened in the last 3 or 4 weeks, but we've been on the road almost the whole season. So that's very interesting. I'll have to come on in and see.
And it's these, like I think Dr. Souther, Dr. Johnson, and I have always been talking about this. It's these small things that really make a big difference and your commitment to those. Yeah, it's frustrating when these things don't get better quickly, but unfortunately, that's just the way the body is. And if you do these things properly, it's not going to be a chronic problem. It's going to be more of a several weeks to months problem. But people that don't want to spend that time to learn a new pattern or to do the small basics right, well, they're going to be stuck with this a lot longer, and then they're going to develop secondary issues because of this. So it's interesting to know, but that's also part why the physical therapy works. You need this hands-on education. Me as a physician, I may give you some of that, but I can't go into full detail on it. That's what we utilize the physical therapist in a multidisciplinary approach for. I'm focusing more on the medications, on the injections, on selecting the right brace. But I can't spend an hour, 2 hours with you. And so that's where we get some of these other specialists involved. And I know some people have some negative views about physical therapy. Yeah, physical therapy is tough and it makes you work, but it gets you better. So keep an open mind.
And all I know is, having been having been in your physical therapy twice, those people are absolutely miracle workers. I mean, they are really, really good, and they work you. I mean, that's not easy in there, but hey, it gets the job done.
Yeah, it's better than surgery. It's better than medications that can have side effects. Let's be honest, a lot of people out there, they have medications or problems that keep them from taking certain medications that are better. If anti-inflammatories are great, but they can have side effects with some people. A lot of people are on blood thinners, can't take anti-inflammatories. And physical therapy is a very high reward, low risk way of getting the majority of our problems better. There's certain things that the physical therapy is not going to help you with. If you're bone on bone in the hip, the research says that physical therapy doesn't help. If you have a fracture, or let's say that you have severe bone spurs that are pushing on your nerve and you need surgery, physical therapy is not going to help that. But I'd say 90 to 99% of orthopedic visits, whatever you're seeing the doctor for, that problem could be benefited by physical therapy.
Well, and like I say, you've got the good ones, both in Stewart and at the main location in Port St. Lucie.
Yep. So one of the things that it's a little bit more unique, some things that we talk about, in the fellowships when you're a non-surgeon is, like I said, some of these topicals. And a lot of people ask, well, what's the best topical medication out there? And the quick answer is that it's a likely Voltaren gel. And that's something that's available to you now over the counter. Voltaren gel is available. You can just go to Walgreens, Publix, wherever, and you can buy Voltaren gel. It's an anti-inflammatory called diclofenac, and you can put that on the injured body part, and it works for a lot of people. For certain problems, it doesn't work as well. For example, if you have a herniated disc in your back, well, it's pretty difficult for that medication to not only go through the skin, but through multiple layers of muscle in order to help your herniated disc pain. Now, if you're having more superficial pain, like a muscular pain, or where it works great for is like on your hands, with some arthritis in the hands, those joints are very close to the skin, and so those work better with those topicals. Now,
Okay, I've got a question on that.
sure.
I was looking at, because I was thinking, okay, I've got a little shoulder pain. That's probably from the new backpack that I'm carrying the equipment in. And it says do not use on the shoulders. Why would that be?
Because it's really only been studied for the knee. And so
Oh,
if you
okay.
really look at some of these labels, the easiest way to study a pain is, and to study it in a powerful way, meaning that there's a lot of people with this problem who will sign up to be studied. You need to search for the most common thing. And the most common superficial joint that they can study is the knee. So that's why all of these medications are specifically approved of for the knee, but doctors all the time use it off-label for these other joints. It's just more difficult to do a study of 100,000 people with elbow arthritis. You just can't find a sample size like that. But knee, no problem. Yeah, and so there's other medications too, and some people respond great to the capsaicin creams or to BioFreeze or to Icy Hot. There's all number of different medications out there, and for the most part, they all contain part anti-inflammatory, part some numbing anesthetic in just different mixtures, and they may include some other natural medications too. But for the most part, you're looking for something that has anti-inflammatory in it. All the rest of it, it's a bit of trial and error. People ask too about CBD oils. That too is a bit of trial and error. CBD, it's not so regulated, and so it's difficult to do high quality studies on something that is not regulated. So I really can't give an opinion on that, but some people it works for. The one that I'm trying.
Joe Montana with his CBD thing. Ah,
Yep. Or yeah, George Foreman does one with
yeah.
yep, he's got one out there too that I've heard patients really like the George Foreman one. That one's interesting. One that's unique and not a lot of doctors know about it is topical nitroglycerin gel. So topical nitroglycerin is something that for a long time we've used specifically for the heart. If someone came in to the ER with chest pain, we'd slap some topical nitroglycerin gel on their chest, because what it does is it opens up blood vessels. It dilates things. Now, the side effect with these is if someone's on nitrates for chest pain, you're on a pill that's a type of nitroglycerin. If you give too much of this to a person, then it can really drop their blood pressure because it opens up too many of the arteries, and that's not good to have your blood pressure drop. Also, things like Viagra, Cialis are a type of nitrate. So you need to be careful with that. And that's one of the first questions they're going to ask you when you go to the ER with chest pain. Are you on Cialis, Viagra, or some of these other ones? Because if so, and I give you this, you're going to pass out. The other common side effect that people will get with this is that they'll get lightheaded, or they will get like a severe migraine headache. And so you need to be careful with the dosing of this topical medicine. But why it's great for musculoskeletal issues is because when there's chronic musculoskeletal inflammation from, let's say, a tendonitis or a ligament issue, well, the body eventually kind of gives up on sending good blood flow to that area, and it calcifies things, just an attempt to heal it in some kind of a way. But it's not the great normal tissue, pain-free tissue that the body wants. But like I said, after a while, the body gives up on this and it stops sending good blood flow. So if you use topical nitroglycerin properly, in the right dose and in the right patient, and again, this takes some patient education too, that topical medicine, it tells the body, hey, you need to bring blood flow to this area, open up those channels, open up those arteries, and send some of those healing blood vessels with the healing hormones and defense cells and healing tissue, so that you can try and repair that chronically inflamed area instead of giving up on it. So using a medication like this selectively is a good option. And there's a few other ones like this that I talk about with patients that have some better research behind them. There's a lot of topicals, like I mentioned, out there that don't have the best research, but there are some with better.
That's
Yeah.
very interesting. It's I've never really thought much about the topicals, but I did kind of fall for the Voltaren thing, and it
Mhm.
has helped the knee a little bit. It's so we'll just have to see.
And with these things, it really takes a combination of things. Just coming in and getting a cortisone shot from me. Yes, sometimes that works great, but really this is a multidisciplinary approach. And for people who've had chronic pain in a joint, yeah, it's doing the right stretches and exercises. It's trying the topical. It's maybe taping the joint or using a brace. It's a combination of all these little things that really amplify each other's success and make it more likely that you're going to get better and quicker. So there's rarely a single thing that's just going to get you better like that. It takes a combination. And yeah, it's frustrating, but unfortunately, it is what it is. Patients are upset all the time, when I tell them it takes a month for their fracture to heal in their hand and they can play basketball again. Yeah, it stinks, but it is what it is. I mean, that's just how the body heals things, and we just have to deal with that.
Yeah, we were talking with a lady who had carpal tunnel surgery
Mhm.
about a week and a half ago, and she's moving her hand quite nicely now. And she just said it hurts a little, but and she just said, I think it's going to be a lot quicker than 5 to 6 weeks. So
Yeah. Yep. Yeah, and carpal tunnel. I think I was talking about it last week. That's one that has a quicker recovery than some others. Like take for example a knee replacement or a joint replacement in the wrist. The ones where you go in and clean out and are not putting in major equipment or are not stitching down important structures that are important for the stability of the joint, you improve much quicker. Whenever you have to start reattaching tendons or ligaments or replacing bone, for the most part, it takes longer to heal. The one joint that violates that rule that heals incredibly quick is a hip replacement. People feel like $1,000,000 the next day after they get a hip replacement. That is the one that kind of violates that rule. For the most part, if you're scraping out cartilage and replacing a joint, it takes a little bit to heal from that surgery.
okay, so why the big difference with the hip then?
You know, uh, so everyone has an opinion on it, and I guess my opinion is this: it's a more stable joint. Take, for example, your shoulder and the wide range of motion that the shoulder has to go through, the wide range of motion your knee has to go through. And it's two kind of single pillars coming together in your knee. Two, yeah, two single pillars versus in your hip, you have that very big pelvis, that very solid pelvis that you're putting that cup into. And the femur, that top part of the femur, it's a much bigger bone with a bigger anchor. And so I think part of this is it's the stability of the joint. Part of it is the great muscular control that it already has with your big glute muscles and your thigh muscles. And when you're doing it with a muscle sparing approach, you're not cutting the muscles and you're not injuring them, so you don't have to heal from that. So I think it's a combination of the big stable bones that we're dealing with compared to the other joints and the nice muscular support. It may also be just the innervation pattern. The hip doesn't have as many nerves that go to it as, your wrist, for example, or to your foot or your knee. So it could be part that too. Um, yeah, but that's my guess. And the part of it is just unknown. We don't know why.
Yeah, and that's and again, hopefully down the line that'll get a lot better in the next few years.
Yeah, absolutely. And actually, that's what we're going to talk about on next week's show, I think. Yeah, I think it's next week's show when Dr. Southern, no, it's going to be the following 2 weeks from now when Dr. Southern is back. He had to do, like, I think it's part of like his military commitment, at one of the bases. So he had to go out there and do some training for a couple weeks. But when he comes back, he and I were going to go through the history of joint replacements, talking about the early stage knee replacements and how it's advanced. And maybe if you had a knee replacement 30, 40 years ago, how is that different compared to now? The same thing with a shoulder replacement. So we're going to go through some of these most common joints, the shoulder, the hip, the knee, and the different stages and advancements. It's very interesting. And now where we're at and maybe what's new. And specifically with the shoulder, he's the one doing all of the really new stuff that's so exciting. Like I've told people before on the show, he is one of 2 people in the entire world who can do a shoulder replacement where he doesn't cut any of the muscle. All other surgeons, if they're replacing your shoulder, they are cutting the muscle. And like we've talked about so many times, if you're cutting muscle, it takes that much longer to heal.
Wow.
So yeah, in 2 weeks, we'll go through some of the history of that and talk about what's new.
That is so cool. That is so cool. Well,
Yeah.
I'll keep sending you Zoom invites too. I think this is really, really neat. Where can we
Yeah.
find you?
Yep, Florida Orthopedic Specialist, and I'm Dr. Joe. Where's Becky? And our telephone number for the clinic is 335-4770, and that'll connect you either to, well, it connects you to both. It connects you to our Port St. Lucie office and our Stewart office. 335-4770, and we'll do it again next week. Thanks, Greg.
All right. Sounds good. And keep that family safe, huh? Okay. Dr. Joe, where's Becky? The non-operative physician at Florida Orthopedic Specialist. Bone Talk on WPSL, Port St. Lucie. WPSL Global. It's 11 o'clock.